Welcome to Akhand Vidyashram, the first institute of impeccable wisdom. We are talking of perfection, perfection, perfection to the core, the central theme issues. I am not talking of periphery, which could be dynamic. It's primarily meant for every human being to be perfectly healthy, wealthy, wise, and happy. And from that point of medical education plays very important role to teach everyone in the world what is a perfect anatomy, what is a perfect physiology, what is perfect biochemistry, what is perfect psychology, what are different subjects we should know to make ourselves very healthy, wealthy, wise, and happy. From that point of view, the impeccable medical wisdom was laid in Madras Medical College by and large. As I've been saying, my dharma, my duty is impeccable wisdom. Let's stick to only that, and that is only core, the perfection. I'm not talking of disease models. The one person who wants to be perfectly healthy, physically, emotionally, mentally, spiritually, otherwise, and be in tune with universal consciousness. What will prepare you to make optimum use of your brain, universal consciousness, and be the perfect walking, talking encyclopedia. That is all what I'm talking about. And for that, the greatest discovery is DIVYANK, the divine design. In the light of DIVYANK, we are going to see what is the perfect anatomy, physiology, biochemistry, and other things so that we can be perfectly healthy, wealthy, wise, and happy. Another point which I have realized that languages by and large have certain deficiencies. Number of letters is less, the words are less, so is ambiguity in words. Same word could mean many things. You see a vocabulary, each word has 10 different meanings, and that is confusing by and large. To eliminate confusion whatsoever in the language, I have tried to convert everything to graphic presentation of mathematics and geometry, and this is a symbol of DIVYANK. Outer is 22 by 21. Then 10 pentagons represent the power of 10. The 0.344 represent by 5 pentagons, tetragons right in the center. That is what I want. So in the case of you find certain mistakes in letters, pronunciation, or otherwise, I can understand, because everyone, what they carry from their childhood would be their process. As a matter of fact, I do know, if I need to find what's the mother tongue of that, all I need to do is scare that fellow, abuse him or beat him, and a true nature will come. He will talk in the language which is his mother tongue. This is something which is known in the language medium. But since different people coming from all the world, and we need the wisdom for the entire universe, we got to come for graphic presentations, the what I am trying to do, so that we have ambiguity. Now, entire physical body and solar system, these two are represented in this Pindant and Brahmand. Everything learned from 1995 to 2015, when I came to DIVYANK, all that information was there. After making this understanding A to Z of every subject, I could recognize, conceive, and reveal DIVYANK for the first time in 2015, which is almost 10 years back. But this particular symbol has remained because this is universal. That is something which I have already, in the light of that, we are going to see the wisdom. And this particular picture has always impressed me. India has given two policies to the world, Dvait and Advait. Dvait is a multiplicity. Jivatma and Paramatma are the two different things. Since they are two separate things, they can never become one. And Advait says, Jivatma and Paramatma are one, and that is a concept I totally agree with it. But to cognize that Jivatma and Paramatma are one, you need a bridge between Jivatma and Paramatma, and that is Antaratma. And that is Arjun talks about it. When you have you body and Antaratma together, your concentration power will be very powerful. You will not be in, you will not see things in three like length, breadth and depth. You can see time space. And I can tell you the science is trying to talk about 11 dimensions, string theory. But it is 10.344, which I have seen within my own eyes, within the ventricles, and I know what it is. Even RBCs I can see with my eyes as a big structures, and 22 by 21 the longitudinal. So the kind of things which I have seen with my eyes are much better than even what electron microscope can talk about it. And it is only because Brahma Sutra says very clearly, Antaratma is a bridge between Jivatma and Paramatma, and that is the basis for Tret Paravidya, in the light of which I have seen with my own eyes, confirmed it, and with the best knowledge we are giving the impeccable wisdom. First lesson which I learned in this life is, first 7 years of your life, do not teach any child what to do and what not to do. Let Atma, which is leading the person from inside, see the things in the light of the Antaratma, the soul. Don't condition it. Let the child grow fully. Brain be developed in 7 years. Let the child learn everything A to Z with an totally and free. And register or what he sees, what he understands into the brain for 7 years. That will be the strength with which he can go to do wonders. If you are going to give some information which is defective, it will be very difficult for the child to understand and recorrect and improve over a period. I am glad the 7 years I did not. I spent my time in Katra and Kashmir, learnt ancient Indian wisdom of Kashmir Shaivism and the beauty in the light with the mind completely, and also of Mata Vaishno Devi, and all the information about Ved, Upanishad, Ramayana, Mahabharata, Prani Kahanis. I had the pleasure of seeing and learning directly from the experts who were speaking from their self. And I also realized that languages have a barrier. But all my life, to all my patients, I tell them to talk to me in their mother tongue, because they can express much better than that. Because my idea is to see the emotions, feel one with the emotions, and that is a better expression than any language whatsoever. But since I was experiencing, understand the word, as a result I am able to understand Sanskrit much better than others. Now I am telling the experts of Sanskrit that you have translated wrongly. Tat Tvam Asi is one such example. No, that is one part. The second thing which I learnt is this particular shlok from Hitopadesh, Vidya Dadati Vinyam, Vinyat Jati Patrata, Patrata Dhan Utpati, Dhanat Dharam, Tatha Sukham. If you want the world to be completely comfortable, sukh for everybody, you got to have a right knowledge, absolute wisdom, impeccable wisdom. That is going to make you very humble. Only people who know everything are very calm and quiet. I never got angry with anybody because I know what it is. Others are getting angry because they're empty and they want to defend. I have nothing to defend. So I can understand their problem because they've been given wrong information. So I can only sympathize with them. Then I live in the knowledge and leave it at that. But when such a community which is free from all defects work together as a unit in any form, any industry otherwise, farming otherwise, they can do wonderful work. There will be a lot of prosperity. When there is a prosperity, there will be dharma, righteousness. When there is righteousness, there will be comfort for everyone. And that is what I understand. Education is the only way which can change the world. Everything else is defective. And reservation of any nature, favoritism of any nature, or buying people with money and other thing does not help. It is only Saraswati, 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 the impeccable wisdom, and Swan's concept to understand the perfection which can make the world perfect. Brahmins who are in tune with universal consciousness can only change the world. Every other person can only give you limited, but impeccable wisdom comes from Brahmins only, and I realized that as a child itself. The third lesson which I learnt, that you have to have an integrated language, which I talk about the 10 stages of Akhand Vidya. But one point which I stand out, the treasure of knowledge or Saraswati is very peculiar. More and more you spend, more and more you share with others, more and more it grows. And less you share, it disappears over a period. Even to have a great memory in your brain for rest of your life, you got to remember things at regular interval and go on imposing. With the time and space, anything can disappear. You need to make a conscious effort, use as much of wisdom to share with as many people as possible to remain vibrant all your life. And since I have done that ever since my childhood, whatever I know, I share with it. That I have a great memory of every event all my life. I may or may not talk about it, but when I think who gave the first idea, I am able to pick it up. You're going to see that today. Now, after completing my primary school education, secondary school education, including Loyola College, maths, physics, chemistry, biology, English, and other subjects, that knowledge, I came to Madras Medical College and Government General Hospital in July 1969. And I can tell you Madras Medical College is one of the oldest medical colleges, started in 1835. But as for a Government General Hospital, was started in 17th century itself, 1668. It's that premier institute which was started by East India Company to take care of their patients, or East India Army. History is very good. Impeccable wisdom, highest order. I have great respect for Madras Medical College, Government Hospital. They laid a foundation in a much stronger way than I see today in the colleges we have. They are giving wrong information. They are not using right books. And children are also not of the class which I can talk about myself. This is where I bring it myself. Since I was thinking of impeccable wisdom, I've been able to do. But today's students are not able to do because they've been fed with a lot of wrong information which need to be corrected, whether they will correct or not correct. But I know next generation I will lead so that people can at least make sure next generation understand. Maybe this knowledge will take over. Now coming to the first lecture in Madras Medical College was introduction by Professor M.M. Cooper, who was the head of Department of Anatomy, and he was also the vice principal. He's the most dynamic person I've ever seen. As a matter of before writing this particular thing, I was trying to wonder what statement did he make in the first introduction, which was way back in 55 years ago, which became the subject of interest for me, became the medium to become what I am today. It took me maybe about 10 minutes, but after 10 minutes I realized the picture very clearly. He said, know something of everything, then know everything is something if you want to become a good doctor. And that is what my advice to everybody. And ever since those days, I became a voracious reader, started reading very fast, understanding the concept, the core concept, and then re-understanding things has helped me to be what I am today. So that way this particular statement of his was very, very useful. There was another statement which I learned from my roommate in Madras Medical College. He had a book, How to Make Friends and Influence People, by Dale Carnegie. And one particular line which stood today, and it is my gospel too, which I keep telling everybody. Be liberal in praise, but never go to psychophancy. And that is, if I find something interesting, I have very liberal to tell them. But I will never tell them if it is defective. If it's defective, I'll tell them it's defective. I do not agree with it. But that particular statement also made me realize that how English language is defective. Because it is psychology, we say psychology, but we write with P. But that also started coming to my mind that we should modify English language the way we write. The way we speak, we should write the same way. American English is trying to improve upon. For example, British English photo, Photo, but American Photo. Like that there are certain corrections, but even then there are a lot of deficiencies which I need to work out. So that's why I'm using symbolic language, graphic presentation in a much better way. This is one example which I want everybody to remember, that know something of everything rather than everything of something. As a result, you are going to get centum marks. Most of people don't even attempt the questions. When you don't attempt the question, you don't know all the subjects, you cannot be on top. So be a voracious reader, enjoy, because the wisdom is there in everything. But if you're lucky to get the perfect books, fine. I am glad that number one point, Madras Medical College second year course, which technically is called first year nowadays, is anatomy, physiology and biochemistry. And it was a period of 1.5 years. And today we have 1 year. 1 year is not enough to understand perfect anatomy, physiology and biochemistry. That's another point which I keep telling everybody, but nobody seems to be bothered. They say we are interested only treating patients. Now their doctors are created to treat patients, not to talk of preventive medicine, not to give you a healthy, wealthy life. No wonder you have a deficiency, because doctors are only to treat symptoms and signs. They are not to tell you what is perfection. So as a result, we have a wide range of values of everything from patient point of view. We are not thinking as the perfect human being. Whereas I am interested in perfect human being. If you achieve that, you will never fall sick. You can curtail aging. And from that point of view, I am glad anatomy department had old Gray's Anatomy, which are beautiful, perfect books, and also the dimensions to do dissections were also by the perfect books by and large. So that was a great foundation, first thing as far as anatomy is concerned. But then my first big problem came up. The first examination in Madras Medical College, first paper of anatomy. I did not realize that how much time I take in answering first question. I did not have the watch, so we had to wait for examiners to tell us, observer to tell us what is the time, or look at the watch and see where we were. So one question I took almost 90 minutes, and there are 6 questions I had to answer in a span of 3 years. 3 hours, 6 questions, but one question 1.5 hours. You can imagine I've consumed half the time for one answer, and I have to answer another 5 questions, another 90 minutes. Was a challenging thing. But the very moment I heard that I have finished, then I started fastening up. So answers in first question were very detailed, as if I'm writing an encyclopedia, A to Z to the kind, which would be an example for anybody. For next 3 questions were answered in 60 minutes, abridged version. Then the last 2 questions were only 30 minutes. And in that process, most of the answers in the last question were only graphic presentations. What is written in first question with the description thing, picture and other thing. Now I brought the whole thing to a grip picture, which picture was auto-explanatory. And at the end of it, I felt I might fail here, because you have to have a minimum 50% marks, and marking was very, very defective, very strict. Getting 50% marks was very difficult. And when you haven't attempted all the questions to your full satisfaction because of the lack of time, but what happened thereafter is something, again a test which I want to tell the world. If you know how to answer in a graphic presentation, self-explanatory, this is an example which I have given down. You can see zygote, the 3 layers on one side, and also the child with the fetus and umbilical cord on the other side, and also give something more for the world to understand. And this is also something which I go and telling people when I say your knowledge in books is defective. For example, I said artery or vein. They say oxygenated blood, arteries, deoxygenated this. And I said no. Arteries carry from heart to the periphery and veins from periphery to the heart. Don't bring confusing oxygenated and deoxygenated. Also, when I talk about the prime function of respiratory system, it is not exchange of gases. It is absorption of oxygen from atmosphere, keeping DIVYANK in mind, and expulsion of 61.803% carbon dioxide, remaining is maintained. Whole system is that. So when you learn the art of perfection, then you answer in such a way that your answer has a question within it, and you can make the person himself. And for that matter, since I had the knowledge of perfection at that stage in anatomy, it was easy for me to deal with the next question, which was also the practical part and the viva. And that is something which I want everybody to understand. If you know how to answer graphically in systematic way, and also the description is complete, there will always be a question within the answer which person is good. And this is something which I learned when I was a child. In 1962 is a movie called Sasural, Hindi movie produced by South, and there is a song, एक सवाल तुम कहो एक सवाल मैं कहूँ हर सवाल का जवाब ही एक सवाल हो, and made me think that I should answer in such a way with perfection that answer has a question and the person who is going to interview me should have that answer, and I can make the person ask me the only question which I want them to ask. But that is what wisdom is all about. If you want to get more marks, you should be wise enough that examiner is in your hands, not you are at the examiner's hand. If you can do that, you will be the most successful. I have been very successful because I mean wise to, I know the full thing, but I know how to use it to get center marks. And you are going to see that as the next part in my answer. Dr. Mary from CMC Christian Medical College, Vellore, came as an examiner along with Sarda Kadrisant, who was incidentally associate professor in my department. She knew him very well. So when they start, morning there was practical examination, it was done. The afternoon we sat down for viva. When we sat for viva, she asked me one question in osteology. And giving that answer, I gave the answer in such a way that rest of the questions which followed for almost 40 questions were exactly what I wanted her to ask me, because I know the depth of that knowledge. And that is what I mean to say. If you are smart enough and you want the person to know that you really know A to Z, you should be smart enough to put in such a way the person gets enlightened. Your teacher, your examiner should get enlightened. If you have reached that level, only then you can expect centum. Otherwise, forget about it. And as at the end of it, she asked me, how did you do your theory? And I was very honestly told her I'm not very happy with it, because I took half the time answering one question, and last question was hardly in 10 minutes graphic presentation. And she said that was the best part of your work. First question you have given in detail, such a beautiful. But last question you have answered is so precise, concise, shows how you are able to convert knowledge into graphic presentation. And now even today, the way viva you have conducted, you have literally made me ask what you want me to ask, and giving me the kind of knowledge that your knowledge of osteology is so perfect that I have no other give you one of the highest marks in this particular subject. I think that was a learning lesson. And I have been telling everyone, unless until you have impeccable wisdom, you cannot get center. But if you want impeccable wisdom, this is the way to be done. You should know A to Z perfectly, concisely, through experience, not from mugging. One more thing which I realized in Madras Medical College was they would have examinations. There were 2 examinations, certain were conducted, some were spontaneous. When it was a spontaneous test without any notice to anyone, I was 1,000 times ahead, far ahead of every other classmate of mine. But when they were organized, then differences would come up, because they would prepare and vomit. Whereas I could give the answer 24/7, anytime and every time. And that is the kind of knowledge which I want people. Don't mug and give. No remote control. You should understand the wisdom. It should be a part of your living. You should be walking, talking encyclopedia. If you want to be wise to Akhand Vidyashram and Akhandata and impeccable wisdom, you need to be totally enlightened. And I use the word enlightened, empowered. You know the light subject completely. That is important. If you want a great future as a teacher, as a research scholar, as a professor, as to change the world. And I think I'm able to give the world, challenge the entire world. Whatever mathematics, geometry, algebra is talking is man-made, defective, not divine, which I'm talking about. Similarly, but I'm not getting to that side. Let people do what they want to do. But medical profession, I want to stick. Let us be perfect human beings. Let me start from here, then expect same thing being applied in other subjects. Next question comes for physiology, and here I'm not talking of the head of department of physiology. I'm talking of Professor A. Namachwam, who was my teacher. He's the one who taught me neuroscience in first year. During those days, each professor would get one subject to study from A to Z in that subject. Unfortunately, these days, the same subject is taught by different people. They don't even know what has been taught by other person. That way, I am very happy that Madras Medical College had a tradition. If it is a kidney, it's a Krishnamurti. If it is a nervous system, it's a Professor Namachwam. That's it. And since I taught me nervous system, I think that became a strength. And literally, he became my professor for PhD in neurosciences only. He laid a great foundation, and I'm glad to write here the book which we read was Best and Taylor and Sampson Wright. And Best and Taylor, in my opinion, the 8th edition of 1967 batch book which I learnt is a perfect. The kind of information available in that is not available in any other book, including Guyton and others. And Mooladhara Chakra, when I talk about ganglion impar or coccygeal ganglion, that picture is there only in this particular book, not anywhere else. There are two chains which are united at the bottom, which Mooladhara I talk about it, Ida, Pingla, Sushmana and other thing. That picture, the knowledge I got from Best and Taylor's book only. Thanks to Professor Namachwam, this is a book and the knowledge which he gave was phenomenal. Now, this particular testimonial Professor A. Namachwam gave after my PhD, where he has written that he knows me for 4 decades because he was my teacher in Madras Medical College, taught physiology and also PhD. He has gone on record to say, I understand the concept of A to Z completely. Even my PhD work started from scratch without any basis on my thoughts, took it to the conclusion which nobody can find fault. And how EEG was taken, how power spectrum was done, how the methodology done, we challenge the entire neuroscience of the world. He has put in this picture, and also the external exam from Brooklyn is also said this is unique, original, path breaking, otherwise that goes back to 2001, almost 23 years ago. But even today nobody else has done that work thereafter. Anyway, doesn't matter, it is my job. I've done it, I'm very good. But this is also one particular physiology department. My roommate, Abdul Ahad Bhatt, did not do very well in the first examination. He thought he is going to fail. And then he was literally lying down, crying in other ways. And I told him, don't worry about it. I'll prepare you for the next examination. That itself will see you through without any problem. I made him lie down. I A to Z of the second paper, I literally taught him. This is what it is, this is what it is, this is the concept I explained to him. As a result, he also improved, I also improved. But I know I did extremely well in anatomy, which became a base for my post-graduation in general surgery, ENT and plastic surgery. But later I came back to general medicine and did physiology in neurosciences. But Abdul Ahad Bhatt, physiology, not very good. So he became a surgeon. He's a urologist doing extremely well in UK today. We are the greatest of friends even today. Starting from 1968 till today, we continue to be like brothers. That is the kind of friendship we should have. Third subject which comes to my mind is biochemistry. These are three foundation subjects which I want everybody to understand. Perfect anatomy from Gray's Anatomy, and if possible physiology from Best and Taylor of older physicians. New editions are not at all that very good. And biochemistry, during that particular period there were not books available. Dr. Ambika Shanmugam, or Professor Ambika Sharma, who was head of department, she taught us, particularly me, from her own notes. And those notes became a book which you can see down. That was a perfect book. I have not seen this book as it is today, but the kind of knowledge she gave it to us when for 1.5 years in Madras Medical College was phenomenal. She was pleasant, fantastic person. I am glad I am able to get her picture and show. And I am grateful to her that she laid a foundation for biochemistry. And I am strong in that and saying if you want to be perfectly healthy, wealthy, wise and you got to keep an eye on biochemistry. You should know what is a perfect sugar, perfect cholesterol, triglyceride, everything. What I had learnt, keeping that in mind, with DIVYANK I have improvised, and I can tell you foundation was very strong in Madras Medical College thanks to Professor Ambika Shanmugam, and I think phenomenal. So I think she deserves to be respected like the Professor Namachoy and M.M. Cooper, which three pictures I have got it. I am very glad. They deserve the kind of accolade which I have for them. But for their strong teaching in Madras Medical College for 1.5 years for anatomy, physiology, biochemistry, I don't think I would have been able to give the world DIVYANK and then describe perfect anatomy, physiology and biochemistry. This is a sense of gratitude which we have to have. And that's what said Dale Carnegie taught me. Be very liberal in your praise, but never say something which is not truthful. Psychology should not be. But unfortunately, student I feel they are giving teacher compliments who are actually useless just because they want to get more marks. By doing that you are only fooling yourself. You are getting marks, but there is no knowledge in it. You should appreciate the people who give you impeccable wisdom, not the one data information which is confusing otherwise. It might give you marks, but your profile will always be like ups and downs. If you look at my profile from school, college, university till today, it's only like an aeroplane going up. There's no peak and valley. For that you need impeccable wisdom from people like Dr. Cooper, Professor Namachoy, Ambika Sharmugam in medical college. And three of them really stand out in my life. Now this is a picture of the hostel where Abdul Ahad bed is the left side on that. And there is a radio, and keeping the radio I taught him the physiology, and we used to discuss every subject. And person who's taking picture is Ram Prasad, who gave me that book of how to meet friends and otherwise, which is again a gospel truth which I carry today. I'll be honest to tell you the truth, appreciate you for good thing, but never lead to something which is untruthful. So that way American writers book on psychology I'm talking about, I like that statement and I teach that everybody be honest to be very truthful. Then microbiology is another subject in the next subject. 1.5 years anatomy, physiology, biochemistry. Then come to the microbiology. And of course the medicine, surgery and other subjects. So first 1.5 years only basic. Then next three subjects you had microbiology, pharmacology, pathology, general medicine, general surgery, forensic, ophthalmology, all the subjects were there. But they are in 3 years. So medicine, surgery and gynecology, forensic medicine, general preventive medicine and others were learned for next 3 years. But one subject which I'm talking about is microbiology. And I was trying to get the picture of Dr. Subramanian, who was the head of department, because he's the one I met first time in Director Medical Education, when he said, you come from Jammu and Kashmir, but all your students from Jammu and Kashmir, they never pass in first lot. And we literally have to push them. And I told him, I'll be the first person to pass all the examination, first attempt with distinction. You don't worry about it. And he was the head of department. And of course, Professor S.P. Tyagarajan, Dr. Sunita Solomon, they were great. But here I learned something which became. But what I learned from them gave me the maximum marks in every subject. And what I'm writing about it, because they have limited subject, defined knowledge, very specific and to the point. Once you know that, you are a walking, talking encyclopedia, you can answer every question. But here in microbiology, I have to explain something. What I learned there at that particular stage, way back in 1971, more than 50 years ago, is immunology had started coming up. And the example given was German measles. If a child gets a German measles, all the children of the area would be taken to the party. Every child is exposed to German measles, so they also develop so that they don't have a problem at later date. This is a natural immunity development system. You can call it inoculation, but directly with the virus which is there. And that is the information which I had very strong within me. And 2019, when we had the COVID-19 coming up, believe it or not, that knowledge helped me, and I told everybody, get exposed to this infection. Don't worry about it. You will develop the immunity required much better than putting mask, avoiding things, taking antibiotics and otherwise. No. But by the time I had already come to the stage, what is the Covaxin? Why is it like SARS? And what it does, what is pathophysiology, how it works on hypertension, of course, like the angiotensin converting enzyme, how it blocks it, what happens to the absorption of sodium, potassium, otherwise, what kind of complaints it could have with the failure of COVID. I wrote those answers, almost 20 answers in Quora at that stage, and everybody appreciated. But unfortunately, after 2 years of experience internationally about COVID, the answers came back to the same thing which I told in the beginning itself. Nothing to worry about. It is a simple thing. All it can do is adrenal failure. Estrogen, angiotensin converting enzyme T to estradiol can have come in the way of absorption of water, sodium and expulsion of that. But if you can expose and make sure the water intake, sodium intake, potassium intake, chloride intake, and keep yourself imbibed with that, you will have no problem whatsoever. It fails only when you do not give. And I think I have been able to help hundreds and hundreds of patients medically by taking enough water, enough sodium chloride, keeping a check on biochemistry and microbiology has done wonders. That is something which I learnt in Madras Medical College more than 50 years ago. That knowledge is not unfortunately given these days. It's called herd immunity. We talk about it, but nobody is following because we don't even say we need to expose it. I never wore a mask and I have gone on strike. I'll not wear a mask. I got admitted for 4 days along with the COVID patient just to see what it does to me. And I can tell you I spent ₹1 lakh, but there was not even one defect which noticed which was unwanted, uncalled for. And that is something which I have learnt in Madras Medical College. If you want to know the impeccable wisdom, be bold enough and think of preventive medicines and reversing aging. Nature will teach you what to do. Start listening to yourself. Your body will tell you whether you need water, thirst, you need sodium, everything will be known to you. Body is the biggest chemical factory, can enlighten you, and there is no other go. I have done that, I continue to do that, As a matter of fact, I'm talking about reverse of aging, and I'm still living. At 73, my biophysical parameters are as good as when I was 21. And it's every 6 months to 1 year I do the test and I see improvement in everything. If there is a deficiency, what could improve with the food is what I would incorporate, and 6 months later or 1 year later I would have the results the way I want it. But that is what is diet all about. That is what pharmacology is all about. And that is what I learnt there. And what I learnt in pharmacology became a base for me to start a pharmaceutical company of my own, Akhand Pharma, which ran for 25 years. Medicine, we were 3 years from 71 to December 73. 71, 72, 73, 3 years. And I was lucky to be in ward which was K. Ramachandra's ward. He was the dean also, head of department also. But what I learned from him in the personal, he said, Sharma, you remember, as the patient walks up to you, 80% are diagnosis you should have. And next 10% asking questions and doing investigation with blood pressure and other things. Still you have doubt, then ask for investigation. Don't ask for investigation at all. And I can tell you, I practiced almost 100 patients a day in a poor area who could not afford anything. Question of investigation did not arise. But not more than one patient needed to be admitted in hospital. Others became perfectly alright, just with diet control and exercise itself. And thanks to Professor Ramachandra, he taught me how to do it, how to feel one, how to feel emotions, what to do and what not to do. And down I have given his autobiography, you can call it a testimonial, where he said he has given all things which he thought about me. I will leave it to people to look at it, what he has written about it. But it's worth reading about it. Second part, one person I was very fond was Dr. Kamakshi. She was chief of head of department gynecology, and all the 3 years I was under her only. This is one of the last pictures we took together, where she is sitting between me and my roommate, my classmate, and Dr. Swarna, otherwise another person I was very, very fond of. She, Dr. Swarna, and particularly Dr. Swarna, taught me how to be perfect gynecologist, perfect obstetrician, what is the perfect anatomy, physiology, and biochemistry. But there is one lesson which I learned from them was in obstetrics, don't interfere at all. Let nature take over. Nature will make sure that you don't have to interfere. It has the capacity of forming oxytocin by the hypothalamus and anterior pituitary. Things would be fine. Least interference the better. Observe. And what I observed and done, today I am writing much better in biophysical parameters. The best example of biophysical parameters or positive feedback mechanism is delivery only. Don't interfere. It is beautifully designed. Let it take over. Don't interfere anything is one lesson. Second thing which I am talking about now, female menstrual cycle, I am telling the entire world, whatever you are teaching is defective. What I learnt and what I built and based on DIVYANK is phenomenal. I have already talked about it. There is no need because we are going to make a video on that completely. Explain A to Z of procreation, female menstrual cycle, which has not been. And one person, Shivbhushan Sharma, is telling the entire world, whatever we've been taught in school, college, university throughout the world is defective. And DIVYANK based female menstrual cycle is perfect. I've already written it, but in detail I'll give you another longer as we proceed. Then Madras Medical College is the one where 1 year of house surgery I've done. 69 to 73 were preparations for medical course. 1 year for housemanship, general surgery, medicine, this, pediatrics, forensic, as well as internal medicine, external medicine, and preventive medicines. It was beautiful examination, trained very well. Very moment I finished that, the very next day I could take over a hospital and run the hospital very effectively. And this particular picture also was made in 1974, and I know that picture shows that how connected I was with spiritual science. And that is something where I learned what pi and structure. I'll not go into detail at this. I have already done pictures otherwise. But here now I'm giving a sum of the things which I did after graduation, postgraduate schedule. I joined Dr. Phillips Hospital, Tambram. The very day I finished my house residency on 9th of January 1975, 10th I joined and did extremely well there. And then holistic family practice I did from 75 to 2015, 30 years. Then I had a resident internship in surgery in 1974 for 6 months. Then post-graduation ENT for 3 years, 76, 77, 78, for to get rid of my cold, which I did not get. So I felt if I can't get rid of my cold, then it's not a specialty for me. So I dropped it completely. Then went on to do resident internship in plastic surgery in Kilpatrick Medical College in 79. And there Dr. Rao, Kamalakar Rao, was my favorite teacher in surgery in Madras Medical College. He was the associate professor. He and Dr. Matangi Ramakrishnan literally gave me chance for 6 months to do kind of surgery which even assistant professors do not. I am thankful to Professor Kamalakar Rao and Dr. Matangi Ramakrishnan. She allowed me to run the plastic surgery single-handedly when those people were not available. That confidence that I know how to do it was another turning point in my life. You are confident, you can do very well, you have nothing to worry about it. Then of course my pharmaceutical research and development started in 1979. Then I started learning all the different systems of healing treatment like pranic healing, Achura practices, Ayurveda, Siddha Vedyam, and of course yoga and other things, which also gave me additional knowledge how to be healthy, wealthy, wise and happy. Then of course 25 years I ran Akhand Pharma, and we started manufacturing good quality medicines for poor patients. Even the director of the institute asked me how you are able to get excellent quality product. 25 years, not even one product have you ever failed in quality, but you are giving it at the most economical rate you can think of. And I told him very clearly, if your intention is to help people, you can find the ways. When your intention is only to make money and extract from poor patients, then nothing can save you. And that is something which I learnt. If your intentions are very good, you will find a ways how to save money, how to pass on the benefit, and keep the margin to everything. And I am glad that 25 years I did that wonderful job, and today I am able to use that for my knowledge. Now coming to the 10th picture, this is the last picture. I think I have done enough for the day. I think that should be enough for everybody to for that. Thank you very